Hello, everyone. My name is Dr. Chudley Warge. I'm president and founder at Prevention Plus Wellness, LLC, located here in beautiful Jacksonville, Florida. Thanks for joining us for today's brief webinar on the differences between Prevention Plus Wellness, or PPW programs, and other typical substance use prevention programs. The problem that we'll be focusing on today is that today's youth and young adults are exposed to a greater number and variety of risks to their physical and mental health, well-being, and success than ever before in history. There is an epidemic of multiple and coexisting risks among youth, and there's 3 points I wanted to highlight here. First of all, that there are many common health risks among U.S. youth. These include substance use risks, but they also include chronic disease risks. Secondly, the majority of U.S. youth are experiencing 2 or more coexisting risk behaviors, and these risk behaviors can exacerbate and interact with each other. Thirdly, health behaviors are associated and can influence each other. For example, wellness habits can oftentimes prevent the onset of substance use, and vice versa. This slide here shows in the left-hand column some examples of the substance use risk that young people are exposed to, such as marijuana use, alcohol use, and abuse, drinking, driving, tobacco use, e-cigarette use, and I'm sure you could list some other substances that differ across the country from region to region and over time. On the right-hand column are, again, some different types of risks, which we refer to as chronic disease risks, those associated with heart disease, cancer, as well as stroke. And these are also very important, and young people are exposed to them, including unhealthy eating habits, physical inactivity, lack of sleep, uncontrolled daily stress, and others. So these are the types of habits, both substance use habits and chronic disease risk habits that young people are exposed to today. And these habits, these risks, if you will, interact with each other and influence each other. There are also a number of problems associated with typical substance abuse prevention programs. There's 4 of those that I want to highlight here. First of all, most substance use prevention programs are quite narrow in their focus. Single risk behavior, like say alcohol or tobacco, or they just address substance use habits. Secondly, they don't address health behavior associations. In other words, they do not regularly discuss the fact that wellness behaviors like physical activity, healthy eating do and can influence and prevent risk behaviors and also help reduce and avoid risk behaviors, and how risk behaviors like substance use can actually interfere with healthy lifestyles. Thirdly, typical prevention programs emphasize negative content and images. So it's not uncommon to see prevention programs with images of a young person with a hypodermic needle in their mouth or passed out on the floor. A lot of statistics are shown, and a lot of scare tactics are used, which have been shown to be ineffective by research, and yet continue to be quite widely used. And also, equally important, they turn off the young person. The older the adolescent or the young adult, of course, they become more experienced. They become actually more likely to question what you're talking about, and so presenting just the negative points of view can end up being very counterproductive. And lastly, most typical prevention programs are too lengthy. They're not productive. They might be 15 sessions, they might be a whole year in length. They just can't fit in most busy settings, whether it be a school or a youth group or faith-based settings or healthcare settings or whatever the case might be. So there are some real potential advantages to connecting or linking prevention and wellness, or prevention plus wellness, rather than addressing prevention or wellness. So, first of all, you can actually unify prevention and wellness in a single program and in a single setting. So rather than having to have a program which addresses alcohol prevention and tobacco prevention and then physical activity, if you can link prevention and wellness, then you can have a program that addresses multiple factors. In fact, all of our programs at Prevention Plus Wellness do address the avoidance of substance use, particularly alcohol, tobacco, and marijuana use, and address the promotion of physical activity, sports, healthy eating, getting adequate sleep, controlling daily stress, and even spiritual behaviors. By doing this, by linking prevention and wellness, you can save time and money, and you're also more likely to have broader and even larger effect sizes. In other words, if you're able to address not just alcohol use in a prevention program, or let's say marijuana use, but you could address those plus physical inactivity, unhealthy eating, sleep. You could see how you could have a much broader effect on the health of an individual and a group. And also, by doing that, to the extent that these risk factors, these risk behaviors are intertwined and influence each other, you can have a much larger effect size. Now, Prevention Plus Wellness programs have a number of advantages over common substance use prevention programs. There are 7 here that I've listed. We'll go through them very briefly. First of all, PPW programs are practical because they're very brief. In fact, our sport Prevention Plus Wellness program is just a single session, and our evidence-based InShape prevention program for college-age young adults also just a single session. So because of that, it can be in the most busy setting. It could be in a healthcare setting. It could be at college or school. It could be at home. It could be in a youth group. It could be in a recreational setting. No matter what, a single session is doable. Secondly, Prevention Plus Wellness programs address prevention and wellness. As we discussed earlier, they don't address prevention only. Thirdly, PPW programs are target positive behavior in images, and that increases interest and participation, not just among the youth or the young adult, but also the parent, the provider, the funding source. Number 4, Prevention Plus Wellness programs are customized to each youth's health habits. It's tailored specifically for them. Number 4, our programs are scripted to increase implementation fidelity, which is a very important issue when you're using an evidence-based program for some funding agencies. Number 6, Prevention Plus Wellness programs are founded on the evidence-based Sport Prevention Plus Wellness program and the evidence-based InShape Prevention Plus Wellness program, and are what I would call an evidence-based Prevention Plus Wellness model. And that's why all of our programs are either evidence-based, meaning that they've been proven through rigorous research to be effective, or they're evidence-informed because they're based on those original programs, including Sport and InShape. And lastly, our programs, all of them, are implemented either one-on-one or in a group setting, very flexible, allowing you to implement them anywhere. All Prevention Plus Wellness programs also use a proven screening and brief intervention model. Now, screening brief intervention models are the most effective of all interventions in the literature, and ours we call an SFGF model. This 4-stage model, 4-step model, refers to screening, feedback, goal setting, and follow-up. The first step is, as we mentioned earlier, screening individuals for their current health habits. The second step is providing feedback and wellness image communication, which connects the drug use avoidance with the promotion of healthy behaviors in images. The third step is setting goals, not just to avoid substance use, but also to improve one or more healthy habits. And then lastly, following up with the participant. That could be a year later by re-implementing your intervention, or in some cases, we actually include other materials, some of them for parents, which can be a good follow-up strategy. At this point, I'm going to stop. Everyone who's viewing this brief video should be able to list at least 3 differences which distinguish Prevention Plus Wellness programs from typical substance use prevention programs. And at this point, I would like to say, please go to our website. If you haven't seen it already, there's lots of resources, lots of content, and we're constantly adding new articles, new news items. If you're interested in substance use prevention, youth, the promotion of healthy and wellness behaviors, if you're interested in young people, parents, whatever the case might be, Prevention Plus Wellness is a very, very good website. We've got lots and lots of good tools. You can also reach us by emailing us at info@preventionpluswellness.com or call us here in Jacksonville, Florida. Our number is 904-472-5022. And again, it's been my great pleasure to present this brief video to you. My name is Dr. Chudley Warich. I'm president and founder at Prevention Plus Wellness. Thank you so much for listening. God bless.